Yeah, so as I mentioned before, I am a doctor. I'm an anaesthetist and I work at Middlemore Hospital in South Auckland. And I have had another part to my job for the last couple of years, which has been as a clinical wellbeing lead within the hospital. And that's kind of a job that I demonstrated a need for and advocated for and got established. And then just in the very recent past, after some lobbying from large groups of us, we've convinced Te Whatu Ora to have clinician involvement or healthcare worker involvement in the wellbeing space, rather than having the same model of it being sitting with people and culture and organisational development without having the voice of the frontline workers in there. So I have just started an interim role with them as an employee wellbeing lead as well. So I did the training through Riders and Elephants for the emotional culture deck, which I loved and thought was a fantastic tool, and was very enthusiastic to take that to work. But in thinking about how I would do that, it felt like it wasn't quite the right fit for the healthcare environment, for healthcare teams, because we don't, in the public health system, we don't really feel like we have a lot of capacity to influence the culture of the organisation, or even sometimes within our own teams. And so I had some real concerns about using that in my workplace and actually potentially kind of traumatizing people by, making them think about all the things they wanted to change, but leaving them still in this situation where they were kind of powerless to do anything about it. So I sort of thought I had a lot of nervousness about using it. So but when Tamara came out with the wellbeing deck, that felt like a much better fit and something that I could really easily use with our teams and with individuals, because whilst we have huge problems in healthcare with burnout and things, I'll talk about that again in a minute, but those are organisational issues that impact on our well-being, and absolutely are things that need to change, but they will change really, really slowly in our public health sector. And so it's trying to keep that conversation going, that whilst it's really easy for us to identify all the things out there that need fixing, we still have to keep ourselves well within that system and allow ourselves to sustain the careers that we've invested so much in already. So I thought I'd just give you a little bit of background information about wellbeing in the healthcare context, wellbeing of our staff in the healthcare context, just so you can sort of understand where I'm coming from. So we have the Association of Salaried Medical Specialists as our union for specialist doctors, and they've done big surveys twice in the last 5 or 6 years, and both times have demonstrated around about a 50% burnout rate in our doctors. So nothing has changed over the 5-year period. But studies in doctors also show, and in all healthcare workers, show that they are a highly resilient workforce. So resiliency training is not the answer to our burnout. We've also been shown in studies, there's been a big Beyond Blue study in Australia, for example. We have higher rates of depression and anxiety, higher rates of suicidal ideation and completed suicide as well. Interestingly, there's been some more recent research on that shows that burnout itself is not what's driving suicide or suicidal ideation. It's coexistent depression that's driving it, and so burnout, if you only have burnout, that's not necessarily a higher risk for that, but coexistent depression is. And the other big issue with all of this is that there's a lot of perceived stigma in the medical workforce. So and that varies a bit depending on what climate you're working in. So in the Australian environment, for example, they've had a lot of trouble with the impact of mandatory reporting on how much people will speak up about the issues that they're having themselves because they worry about threats to their careers. We don't have those kind of regulatory issues so much in New Zealand, but there is still this idea in the healthcare workforce that we're supposed to be the people caring for other people, and we're not supposed to need care ourselves, which is of course ridiculous when I say it, but that's sort of what goes through people's heads. We're supposed to be the ones that are, you know, good in a crisis, can deal with all sorts of terrible things coming at us in emergency situations. We care for the other people, and stoicism's been a really kind of valued thing in healthcare for many years, and that's it makes it really difficult for people to speak up when they're struggling. But we know from these surveys that huge amounts of people are struggling, and you know, I find that once you start to share, be a bit vulnerable and share your own experiences, it definitely enables people to speak up and share their own stories. And I have shared my own story on stuff.co.nz, so I don't have a problem with sharing my own stories, which is probably why I'm working in this space. We also have a lot of research showing what impact unwell healthcare workers have on the healthcare environment. So there's clearly demonstrated links to worse quality of care, worse patient outcomes, poorer patient compliance with treatment plans, and poorer patient satisfaction. So there is actually a kind of financial bottom line to all of this, really, for workplaces. And then, of course, there's personal impacts as well, with increased substance abuse, relationship breakdowns, that kind of thing as well. It's all very cheery, isn't it? There are some drivers of burnout that have been identified in doctors, and I guess I have written some personal factors there which contribute to that, but it is burnout is very much an occupational distress syndrome. But there are some things in there that kind of I've highlighted because they kind of link to the benefits of using something like the Wellbeing deck for getting people talking. So, for example, the kind of ones around behaviour and breakdown of community within healthcare, and values conflict and those kind of things, I think by using a tool like the Wellbeing deck to really explore feelings at work and values and things like that, that helps us start to have conversations about these things and start to be able to change the culture within healthcare. And similarly, I guess, you know, leadership behaviours as well. That's kind of a little bit about understanding your staff and what's important to them. We know that burnout is linked to, in doctors, to what percentage of your work you get to spend in tasks that are most meaningful to you. And all you really need is 20% of your time spent in the work that's most meaningful to you to have an impact on burnout rates. And that's a threshold effect. So once you get more than 20% of your time, it doesn't impact any further on your burnout. So it really is just, you know, 1 day out of 5 doing the things that float your boat the most, which doesn't seem like it should be too difficult, but we're under huge amounts of pressure and short-staffed and things like that. So that's definitely getting eroded, and that's what's eroding that kind of sense of community within healthcare, both time pressures and also the way hospitals are set up. So there used to be you know, SMO lounges, SMO senior medical officer. So there used to be doctors' lounges or gyms or things like that. And as spaces kind of become a premium, those are the things that go. Yeah, so it makes it a lot harder to find that connection. And of course, just the growing size of everything, as things get a lot bigger. You don't connect with people as much. My own department has got over 70 anaesthetists in it, and anaesthetists obviously tend to have private components to their work as well. So we have a lot of part-time people, and we're increasingly finding we're having conversations with people that you haven't seen for ages. So it's really hard to have, you know, connections with people across your department if you just never see them. So I myself and a group of colleagues who are all emergency medicine physicians have established this very small company called Thriving in Medicine, and we've started running wellbeing retreats for doctors, and this is where I've been using the wellbeing deck. So we've just started them this year. So we've had 2. We run them at Kamiora Eco Retreat in Kaitieri, just out of Nelson. And they really are about bringing a relatively small group of doctors each time together to talk about the issues that are impacting on us, and to explore what's underlying it all and what it means to be well within a healthcare context, and share ideas and things like that. And the benefits are really around people realizing that they're not the only ones going through this, and making connections, and coming away, or also just having 2.5 days to kind of relax and regroup. And we've got a lovely yoga instructor that comes along and has it's very restful yoga. It's there's lots of lying and almost falling asleep and meditating and things like that. So it's all about rest and rejuvenation as well. So this is really where I have been running the Wellbeing Deck workshop each time, and it's really resonated really well with everyone that's come. And I just run it through exactly as sort of originally designed, and everyone has their big sheet to fill out, to take notes on and things. And everyone always wants to take the deck away with them, and you get lots of comments about how beautiful it is, how aesthetically pleasing it is. So they love playing with it from that side of things as well. And they just run with it straight away. Excuse me. People just get straight into talking about their feelings, and because it's just about being human, really. And so they're all human beings that are there, connecting about what makes you human and what the challenges are within healthcare. It's really interesting as the facilitator and having that oversight. The first time we ran it back in March, just kind of seeing the themes that are coming out as I walk around we usually have 4 tables of people running the wellbeing deck through together. And the first time we ran it, the themes that were coming out were all around about the challenges, were all around individuals, more what I would call individual things, so more about the sort of imposter syndrome, and that was a big one, really. And then, so that was run in March, sort of end of summer. And then we've had the winter that we've had in healthcare, where we've had, staff illness, increasing COVID cases, staff shortages, staff leaving healthcare. People really swamped. And the themes the second time around were very much about the behaviour in the organisation. So there was lots of themes around not being listened to, not being respected, not having autonomy, those kind of things. So it was really interesting to see it potentially as a tool for, even though I was running it in a really small group, they were people from across the country. And so it kind of tracked well with what we were seeing in the system overall. And interesting to reflect on it potentially being a way to bring to the surface kind of the key issues in the workforce as well. Really useful for people, really well received. I could see people learning off each other in terms of things that they've done that have impacted positively on their well-being, and how they've done that, and taking away little sort of tips and tricks from each other when it gets down to sort of the practices that they're going to take away with them, and people reconnecting in with hobbies that they ditched when they started medicine because there just wasn't, it's too many exams and all that kind of stuff, and thinking, oh yeah, I used to really love knitting, or things like that, and making an intention to kind of go away and reconnect with those kind of things and prioritize some time for themselves. So we have had, we send out a survey after each of our retreats, and I was just going through that recently just to put this together, and it was definitely the most highly rated session out of everything. So 90% of the attendees have found it extremely useful. As I said, everyone wanted a wellbeing deck to take home with them, and I know that several of our delegates have gone away and run a wellbeing deck workshop with their own teams back at their own hospitals. And you know, this is the sort of feedback that we've had, that the wellbeing deck session was one of the favourites from the retreat. So so really positive impacts, and I'm going to hopefully start running it with our trainees in our anaesthetic department. Just struggling to find some time that doesn't get taken away from them with service provision, which is part of the problem. And also just starting to, now that I've run it at the retreat in a small group a little bit, I've offered to run one for one of the big anaesthetic conferences happening next year in Australia. So bigger group, so a bit more of a challenge. So we'll see how that goes. But it's, yeah, I think it'll be well received. So that's my story. I'm really happy to share any additional information offline at any stage with anyone that wants to know more about what we do with that. But thanks Tamara for developing this. It's a really useful tool to use, and I also always end up telling the story of why you came up with the practice cards that you shared really early on when you were developing it, and you talked about not being able to verbalize when you were really distressed what would help you, and that's how it came, and that people really love that story. It really personalizes it for them as well. So really always appreciative that you shared that story behind developing it with us as well. Thank you.
Thank you. Oh, wow. Huge round of applause for Joanna. That was amazing. Wow. I actually feel quite emotional. That was a really powerful, I think a really powerful story to share, and the impacts that's having. And I think I can only speak for myself, but I imagine all of us have a lot of empathy for people in medicine, especially over the last few years, and just knowing that there's people out there who are helping with their own doctors' well-being, health practitioners' well-being is so comforting to a person from the general public. I find that very comforting and a very important work to be doing.